Okay, so I have my sterile gloves. So I'm going to open them and put them on. And then go underneath the flaps. And you can touch a 1-inch border. So if you need to do some straightening out. Then you want to touch the inside, have your palm up. And then keep your thumb up. Slide underneath here. And then you can adjust the cuff by sliding it underneath, not touching the outside or the inside of the glove. So we're sterile to sterile, so we can touch. We're gonna get rid of this. Okay. So now we're gonna begin by setting everything up. So this is where we decide which hand is going to be sterile and which hand's not going to be sterile. So this is going to be my non-sterile hand and this is going to be my sterile hand. So I'm going to lip this. I'm going to pour it in, protect the label. Make sure you protect the label. Okay, so then I'm going to get my syringe. We're going to drop some sterile saline. I would have saved the irrigation tray to hold underneath with my non-sterile hand underneath the wound that we have. But it's on the floor, so we're just gonna make a little bit of a mess. And the wound should be propped up so that way the water can run down it, because you want to start at the top and let the water run down. So I'm not. So the wound should be like this. And then you want to just start the stream from top to bottom. I should have took the cap off, but it's fine. We're going to start at the bottom and let it run down. You keep going until it runs clear. And the reason why it's squirting everywhere is because I forgot to take the cap off, but it's fine. So we did that. Let it run clear. So now we're going to get some dry gauze. And we're going to use the crouton method and just get to where you have different corners, because for each corner you're going to wipe a different section of the wound. So, and then switch corners, wipe. So we did that. Discard of this. Then we're going to begin. We're going to put a skin protectant on it if there's anything like that, any antibiotics, anything topical that we need to put on, we'll put on now. We're going to we already dried the outside of the wound, so then we're going to begin packing the wound. So we're going to non-sterile hand, then we're going to come here. We got some moist gauze. You don't want it like super dripping and super wet, but you still want it to be moist. And then you want to just crinkle it up. That's way it's easy to pack with your Q-tip. So you want to just stick it in the wound. Look more professional if this was a real wound. And you want to make sure not to turn your back on your sterile field or reach over it, which I probably reached over it a few times, but this table is too small. And you just want to keep backing. And we're all packed in there. So we'll get rid of that. Then you want to put a dry gauze over top of it. I reached over sterile field again, which I should not have done. I should have wrapped around. And then you want to get your ABD pad. You want to put the blue line up and then put that over. And right now it's a clean technique. So you would take and put your tape on. And I forgot to mention, if there were any drain tubes while you were cleaning the wound, you'd also clean around the drain tubes as well. But we didn't have any on this one, so just want to put your tape around it. There's some right here, and then you'd name and date it, and then you'd help the patient to a comfortable position, give them their call light, put their bed in their lowest position, get them anything personal, ask them if they need to use the restroom. You would take off your gloves, perform hand hygiene, and then take off PPE and perform hand hygiene. So that's it.